to be followed by all members of the board, however, whatever is the contribution they make to the board, however they are influent in the society, they have to abide by the discipline and the rules. This is the first, the discipline. Second, it's the integrity. So no conflict of interest between board members and what's happening on the ground. Of course, financial audits, reporting the figures, being transparent with society, because this is what creates trust, and this is what helps our fundraising team to build more and more capacity to help more and more children. If we add to integrity, we have to add diversity. And inside our board set, we have to have people with skill sets which are different one from the other, in order to create positive and collaborative discussion inside the board, to see challenges ahead and tackle them from different angles. And of course, one of the most important parts, which I think is the most difficult part, it's the succession planning inside the management and inside the board. So, in order to identify 5 key roles for board members to successfully govern, with an authority matrix, with a 360 evaluation, with an HR diagram, and of course renewing the board, and I think I'm the best example of you pushing me in and us believing in the mission 4 years ago. 2, how to build and to monitor the mission. Well, the mission is something very intangible. How to monitor and build the mission? First of all, we can count the numbers of volunteers applying to the mission, and we can say that we have more than 500 volunteers willing to apply to CCCL every year, and this is on the rise. 2, we can calculate the staff turnover rate, and we are very proud to know that we have a staff turnover rate which is less than 5%, which we don't see anywhere in any organization. 3, the job applications, we think that we are the Google of the Middle East because we receive 10 times more applications every year than the numbers of our employees. So this gives us the chance to get the best people on board. 4, the result of the 360 evaluation is looked by the board and followed up. This is just 4 examples. We have much more to do, but I think that time constraints is important. Then, the non-financial performance assessment, medical curate, you've heard about that with Dr. Solh, customer satisfaction, making sure that both with tangible KPIs, the donors and the children and the parents are really happy about the treatment they get. The brand equity, what I can say today is that we are in the top 4 brand equity in the NGO sector. The certification and the ISO certification, which we have done that in 2008 and renewing that again now, and the benchmarking, comparing these key KPIs to other centers. 4, the financial. The administration efficiency, we just spend 14% of the fundraising into costs of non-medical. All the other is going for medical. And if you compare this figure to any other organization in the world, and we were talking about that with Rick yesterday, it's exceptional. And what I can say, this is going down and down and down. Fundraising efficiency, so knowing how much we can. If we do an event, today, just 7 to 8% of the cost of the event, of the revenues of the event are going for the cost, and all the others are being kept as revenue for the children. And this is being monitored by the board. Of course, cash flow and working capitals, and having a third-party administrator to follow up daily on all the invoices we get from the hospitals to make sure that they are aligned with our agreements. And of course, an external auditor, which is following up details of our financial balance sheets. Last, the risk factor. So a quick graph showing that the 20 highest donators at CCCL last year was 31%. We followed that very closely in order to make sure not to be linked to anyone to create a sustainability over long term. And here I would like to give a figure. In the States, on average, the donation per year is $35. So if we can bring this culture back to the Middle East, and we can push people to donate $5, $10, maybe every year, we can reach a point where, by small donation, we can get a big amount. The challenge is ahead, and this is one of my last slides. Increased numbers of patients, as you can see over time, it's increasing 2, increase in the cost of treatment. I can give an example. Immunotherapy today is costing $300,000 to treat one child, and this cost is on the rise, but this is very important to help the children in order to increase their immunity to be able to fight the cancer. 3, and this is the cost of treatment over time, so $55,000 a year for every patient, knowing that the patient needs 3 years to be cured on average. The Syrian refugee crisis, 160 Syrians are born every day in Lebanon, and this has to be tackled also on the long term with international help. And the capacity and the medical availability in order to receive the children inside the hospital. Together, we can make a big difference to make every child smile. I thank you for the time.
Yeah, thank you, Nicolas. It was good. It was not fast. We lost 3 minutes with you now here. Well, I actually, why did I delay you, Dr. Tezer? You know, 2 doctors, MD, one next to the other, you know, it's going to make people bored. So I thought I would put Nicolas to cut it in between. Now, he took part of your cake, but I will give you part of mine. So let's invite Dr. Kutluk, Tezer Kutluk, professor. He is the immediate past president of Union for International Cancer Control, Department of Pediatric Oncology, Hacettepe University, Faculty of Medicine and Cancer Institute in Turkey. Thank you, Dr. Tezer, for being with us today. I appreciate you coming here. That was a long trip.
First of all, I'd like to thank the organizers. I'm very much delighted to be here today. This is my 3rd time in this beautiful country. Actually, I'm also very impressed to see the progress done at the Children's Cancer Center of the Lebanon. My story with the pediatric oncology started when I was a resident in pediatrics in the most prestigious university hospital based in Ankara. I was a fellow in pediatrics in 1983. It went well, and in 4 years, I became a faculty in the same department. I was quite successful. I was so happy with what I was doing in the most prestigious university hospital in Ankara. People are coming to look for treatment. University is doing well. I had capacity to publish and make good reputation, make money. Then I realized I can contribute more than 100, 200 patients, because each year I was able to contribute and treat only 100, 200 patients in that university. I see the potential. I can contribute more to fight against cancer, not only the childhood cancer. So I look around, I went to the Turkish Cancer Society. I worked for Turkish Cancer Society as a volunteer in mid-80s. For some years, 20 years later, I learned a lot from the Turkish Cancer Society. Then I look around, I should learn from others. I went to the international level. I started to work with the European Cancer Leagues, which is an umbrella organization for the European Cancer Leagues, covering more than 30 cancer leagues at the European level. I was able to bring my experience from Turkey to the European level. I was also able to bring the experience that I learned from the European level to my country. That was a good example. Then things went well. I became the first pediatric oncologist president of the UICC, which is the largest and oldest cancer NGO in the world. At the moment, we have more than 1,000 member organizations in 163 countries. UICC founded in 1933. It became a very powerful organization. During the next 5-7 minutes, I will try to share my inspiration and my experience with the UICC at the global level. Cancer is a problem. I will not go in detail of because time is limited. I will give one message from each slide, because I have too many slides. It's a big problem. 14 million new cases per year at the global level. The burden of childhood cancer is already mentioned. It's more than 300,000 cancers per year. Actually, IARC is about to release next week the new cancer that they already put their website, the new statistics, but we are expecting more than 300,000 childhood cancer cases per year in children and adolescents younger than 19 years old. This is a big challenge for us. And the incidence, the frequency of occurrence of the childhood cancer is also increasing. This is a large European study showing us that every 10 years, the incidence of childhood cancer is increasing 1%. You may think that 1% is small, but when you look at the population of children at the global level, it's a big number. The incidence is also increasing all around the world. Cancer in children is the second common cause of death in US and many other parts of the world. But the biggest challenge, as said earlier, the survival rate for the childhood cancer was around 20% in 60s. Now it is it's about 85%. 80% in Lebanon, 70% in Turkey. This is a revolution on the treatment of the childhood cancer at the global level. You will see the results from the CR database from US. For all sites at the top of the slide, you will see the survival rates is 84% in children diagnosed in mid-2000s. And also, it's already mentioned by other colleagues, this is another revolution proved by the Senju team. This is the survival in children treated in Senju since 1960s in children with leukemia. It was almost incurable in 60s. Now almost 100% curable childhood leukemia. This is an example from childhood leukemia, but we have many examples from other cancers too. This is an example from my center. I was able to collect and analyze the data. The survival was about 20% in my center, although it is one of the good centers. It increased within the last 40 years to 60%. Now it's around 70% in my center too. But the problem at the global level, the biggest challenge is global average is still 50%, although childhood cancer is more than treatable at a level of 80% or even more than that. The global average 50%. This slide, maybe it is hard to see from the back, but the horizontal line shows the amount of money spent for the health per capita. The vertical lines show the survival rate for the children. At the left part of the slide, you will see some countries which is almost 10 to 20% survival rate for childhood cancer. Those countries are spending minimum amount of money for their health care costs per person. On the right side of the slides, if the country spends more on the health care, the survival rate is about 70 to 80%. This is the challenge for all of us. How can we increase the childhood cancer survival rate at the global level? That's an organizational issue. It doesn't matter how successful you are personally, but if you don't work together, the success will not come to us. By understanding this reality, the four big organizations, International Diabetes Federation, my organization, UICC World Heart Federation, International Union Against Tuberculosis and Lung Disease came together and established an alliance. 10 years, 20 years ago, I wasn't imagining one day diabetic people, heart people, tuberculosis people, and cancer people work together for the one common purpose. That happened in 2010. They come together and they work together for the control of non-communicable diseases, including cancer. The reason why is WHO believes that non-communicable deaths due to the non-communicable diseases can be decreased by 25% by 2025. Then 3 other organizations joined us, and those 7 organizations made the biggest alliance for the control of non-communicable diseases at the global level. I always work hard, but I always became very lucky. During the United Nations General Assembly in 2014, United Nations requested a civil society representative to talk on behalf of the civil society in their annual meeting. for the review of the level of the non-communicable diseases. Many organizations nominated somebody from their organization. Somehow, I don't know why, the United Nations picked me to represent the civil society. I had 10 minutes to talk. My team and I sit together, write a talk. Within that talk, everybody, that was about non-control of the non-communicable disease, not only the childhood cancers, all of the non-communicable disease. But everybody was expecting me to say something about the childhood cancer. My example, from my center, about a refugee child with retinoblastoma. Although we can even save her vision, we just saw that child with retinopathy once. Probably she died. I gave that example in one sentence in my speech during the United Nations General Assembly. You all know the Millennium Development Goals. Not 100% successful maybe, but Millennium Development Goals definitely contributed a lot to child health. Not only me, we all civil societies were following what would be the next after the Millennium Development Goals. The due date for the Millennium Development Goals for the world was 2015. Then the opportunity came with the Sustainable Development Goals. For the first time, the goal number 3 is related with the health. This is the first time United Nations put a target at the global health. We all should use this opportunity. Then we organized our Cancer Congress in Paris this year, 2016. UICC in early years also had many things, not only the advocacy, but also the clinical oncology.